so much for joining us today, and welcome to our second session this fall of the ICS Health Equity Speaker Series, which, as you may know by this point, it's a virtual event hosted by the Science Office. And it's really about sharing theories and practices around using race and related data that we have here at ICS. So today's session will provide a brief overview of the recent changes made to surnames, and this is the data set formerly called ethnic that you may be familiar with at ICS, and including why these changes were made. So our speaker today, Dr. Baiju Shah, was the lead of the original working group that was assembled to explore the use of surnames at ICS. Before I introduce today's speaker, I want to open with a brief land acknowledgement as well. So obviously, ICS is based in Toronto. We're based on the traditional territory of the Wendat, the Haudenosaunee, and the Anishinaabe, including the Chippewas and the Mississauga of the New Credit. But I wanted to touch briefly that I've been learning quite a bit more about Inuit and colonialism in Nunavut. And understanding the data we have at ICS and how someone's surname or family name does not always reflect or accurately reflect a person's cultural identity, I want similarly to share a little bit of what I've learned about Project Surname. So Project Surname was proposed by the Northwest Territories Council in the late 1960s. It was a way to move past the federal government's e-number system. And if you're not familiar, between the 1940s and 1970s, e-numbers were assigned to Inuit and stamped on discs, which Inuit in the Canadian Arctic were forced to wear to keep track of census data, medical records, etc. And they were often referred to by their number and not a name. So through Project Surnames, which was launched in 1970, Inuit were told to choose and register surnames or family names along with their given name. So although there were consultations with about 12,000 Inuit people, during this process, many argued that surnames did not exist in traditional Inuit culture. Some felt that Project Surname only reinforced European naming methods and ignored those more traditional ones. In addition, despite assurances that the surname process was voluntary, many people had no say in their name choice. In some cases, people who were not home when the rename happened returned to find that their family names had assigned them a surname. Today, many Inuit people have changed the spelling or their name entirely to align with the Inuit languages, emphasizing return to traditional naming patterns. But really, I encourage you all to learn more about Project Surname, some of the positives and negatives that came out of it, as it's always beneficial to kind of continue your learning in this area. With that, I'll now introduce our speaker today. So Dr. Baiju Shah is a health services researcher and clinician scientist in endocrinology. He's a staff physician and head of the Division of Endocrinology at Sunnybrook Health Sciences Center and a scientist at the Sunnybrook Research Institute. He's a professor in the Department of Medicine and the Institute of Health Policy, Management, and Evaluation at the University of Toronto and a senior core scientist at ICS. His research seeks to understand and improve the quality of care and long-term outcomes of people with diabetes. He has national and international leadership in several areas of research, including diabetes care in immigrant, Indigenous, and other disadvantaged populations, long-term cardiometabolic consequences for women following gestational diabetes, and novel models of healthcare delivery to improve outcomes. So with that, Baiju, I'll pass it over to you to introduce our content today.
Great, thank you very much. Let me share my slides. I'm perhaps able to do this with Teams. I might figure it out. Let's see, did that work?
Working clear.
Okay, perfect. Thank you. So thank you for the opportunity to present about the surnames database and the changes that have been made to it recently. And first of all, just as a bit of context and familiarity, this is actually a new name for the database. This was the formerly known as Ethnic database, so that may be more familiar to some of you because that's been the name for a decade or so. But we have recently renamed it to Surnames, and we'll get into the sort of some further discussion about that change as well as other changes that have been made to these data and their access. So talk a little bit about the background of the database, and then we'll talk about the new controlled use processes and the rationale behind those. And then I'll just give some examples of the use of these data in ICS projects and some important, I think, good examples of how it's been used, and hopefully use those as a guide for how to use that in your work in the future. So I mean, this all started when I was fairly early in my career at ICS, and I was interested in looking at race and ethnicity, specifically as it related to diabetes, and with particular interest in South Asian and Chinese populations, in part because those are the largest two visible minority populations in Canada, but also because the sort of recognized impact of diabetes in those two ethnic groups in particular. But when I was starting this work back in like the 2005, 2010 kind of period, there was really very limited population level data that captured race or ethnicity or sort of related metrics. So there was the Canadian Community Health Survey, which is a self-administered or a survey that's administered to a cross-section of Canadians each 2 years at that time. And it included questions on self-reported ancestry in that questionnaire. So those were data that were available to us that captured ethnicity or race or that related concept. And then, there was also the IRCC or the CIC data set, the Immigration, Refugee, and Citizenship Canada data set that has data on countries of origin and languages of origin and so on. But even at that time, it wasn't a general use data set. It was available for specific projects and for work that done by the people who brought it in. So that wasn't available for general use. And really, that was it. There was no other data that was available to look at these questions using population level administrative data. So we sort of set out to kind of create this other way of identifying South Asian and Chinese folks in Ontario. And we explored the option of using surnames to identify people's backgrounds. So there's been sort of this long history of the use of surnames to identify ethnicity in health research, and it's been used in many different contexts and different countries around the world. Probably some of the oldest use in healthcare research was in the US, where the census generates this list of Spanish surnames that they've been doing that every census in the US since the 1950s. And those surnames have been used in health research to identify Hispanic populations from clinical and population level administrative data. So that's been a fairly long period of use. Our interest was less in sort of Hispanic names, but more in the Chinese and the South Asian names. And similarly there has been some use of these data. And in part, it was helped by the fact that for many Chinese surnames, they are sort of a relatively small number of traditional Han Chinese surnames that are used. They can be anglicized in a number of different ways, so the spellings may be variable, but it's from a relatively small core set of initial surnames that we create those names. And so over the 80s and 90s, there have been many lists of Chinese surnames that have been developed in the UK and in Canada and elsewhere around the world for these kinds of health research purposes. And actually, even within Canada, there have been a number of lists of Chinese surnames that have been validated against place of birth, for example, as a sort of measure of Chinese ethnicity. There was another interesting study that I found that looked at phonology rules actually applied to the telephone book in Waterloo, back when there were telephone books, to identify Chinese surnames. And then they actually called people up and asked, what's your ethnic background, and used that as a self-reported ethnicity measure, and found that this list of surnames had about a 78% sensitivity and an 80% positive predictive value. So, not great, but reasonable. And so there was a number of these existing Chinese surnames databases that had already been created and validated to varying degrees in Canada that we could start from for our work. For South Asian surnames, however, it was a little bit more complicated because there's quite a large diversity in different languages, religions, and cultures for South Asian names. And that makes creating a sort of unifying list of South Asian surnames more challenging. There has been a lot of work in this area in the UK, and there was actually several computerized algorithms that have been developed that use both first names and surnames to identify not just South Asian ethnicity, but even subcategorize it into, this is a Punjabi surname or a Gujarati surname or a Bangladeshi surname or whatever. And these have been used quite a lot in different parts of the United Kingdom. But the challenge that they discovered even there was that when they would do these validation studies of the whatever algorithm that was developed in their particular setting, they would find excellent sensitivity in their local region, but even elsewhere in the United Kingdom, they found relatively worse sensitivity or accuracy in identifying people's South Asian identities. And that just reflects differences in immigration and settlement patterns across the UK, and different populations of migrants from the South Asia have tended to settle in different parts of the United Kingdom. And so a list that's validated in Leicester with a large Gujarati population isn't necessarily going to work as well in Southwest London with a large Punjabi population, for example. So this was an issue. And so, you can imagine them trying to translate that to Canada, which is an entirely different history of South Asian migration, would be even more challenging. So there were other South Asian surnames lists that were developed elsewhere in Canada, including this one that I've shown here that was derived using mortality data from death certificates, which included information on someone's place of birth, and used that to ascribe South Asian ethnicity and use the surnames that were generated from that, and found actually excellent sensitivity in Hamilton, but to what extent that was going to be generalizable elsewhere in Ontario was uncertain. So we set about trying to create our own Ontario-specific lists of surnames that would be useful to identify people with Chinese or with South Asian origins in Ontario. And we started with those previous lists that had been generated by others in Canada. We didn't use the British ones, but we used the Canadian ones for both ethnic groups. And then we enriched it with a list of South Asian surnames that came from Indian census data. And this is India before it was even partitioned. So this goes back to the 1920s, all the way to the 1970s of Indian census data and surnames that were in the considered identified through Indian census data. And then we did a selection with a panel of reviewers to go through all the names and choose those that were specific for South Asian surnames rather than not necessarily sensitive. And that was a deliberate choice. We wanted to have specificity so that we would be able to create cohorts of South Asian individuals rather than sensitivity. But what that meant was that names that were common to multiple ethnic groups, so for example, on the Chinese lists, names like Li or Yang that are common in Chinese populations, but are also common in other ethnic groups, including English or European names, we removed those from the surnames list because we wanted to preserve specificity. And similarly, on the South Asian lists, we removed names like Ahmed or De Silva, which again are common in South Asian names. They could be, Muslim names or Goan Christian names, but are also common in other Muslim nations and Iran, Iranian immigrants and Arab immigrants, or in the case of the Goan surnames, of course, very common in Brazilian or Portuguese immigrants. So those similarly were removed from our list of eligible surnames. And so we came up with a final list, which we felt was the most specific for South Asian surnames and for Chinese surnames. We then applied this list to the unidentified RPDB. So this is the version of the RPDB that comes in from the ministry to ICES and that only the handful of data combinators have access to. And, basically the five, and this is a simplification, of course, but, it's a list of everybody's health card number and their surname and first name. And then we applied our algorithm to that to create the ethnic database, as it was called at the time, or as it's now called the surnames database, where basically, of course, the health card number is scrambled as it always is to the IKN. And then we assigned each individual to their ethnic group based on their surname. So if their name was on the Chinese list, such as Cheng or Yuan, they were assigned a Chinese ethnicity. If their name was on the South Asian list, like Kumar or Banerjee, then they would be assigned to the South Asian list. And if their name wasn't on neither list, then they would be assigned to this general population or not Chinese, not South Asian population. And that, of course, includes Anglophone names, Francophone names, and names from other ethnic groups in Canada that don't happen to be Chinese or South Asian. And those would all get sort of lumped into the general population group. We then took this data set, this ethnic data set, and validated it against self-reported ethnicity from 3 cycles of the CCHS, and found, as expected, very high specificity, because that's how we had deliberately constructed the surnames to have. So we had 99.7% specificity for both South Asian and Chinese surnames. But of course, poor sensitivity, and that was, again, not surprising. But 80% for Chinese surnames and about 50% for South Asian surnames. And again, this is not to be unexpected. The common names like the Lees and the Youngs were excluded from the Chinese list, and the South Asian list really didn't have any of those names that could be in other ethnic groups. The positive and negative predictive values were also reasonably good. But what are the implications of this? So this method of generating this data set, ethnic or surnames, has a number of sort of consequences that we need to consider when using it in research purposes. So as I pointed out, of course, high specificity. So that means, that, and this was why we did that, was that you could form a cohort or define a primary exposure variable of the ethnicity of an individual, so South Asian or Chinese, because that's really what you're interested in studying. You're interested in studying a cohort of South Asians, and you want to make sure that the people in that cohort are actually South Asian. And if you miss a few, so be it, because your focus is really on that cohort being South Asian. But the low sensitivity, therefore, means that using this as a covariate or an adjustment variable in a larger cohort is going to be problematic because, in fact, half of the South Asians are not going to be labeled as such. And if you try and adjust for South Asian ethnicity, well, actually, half of them are within your general population. And so it's not really going to be a meaningful way of adjusting for this factor as a covariate in an analysis. And similarly, it's not going to be useful to look at the prevalence of the ethnic group, right? You can look at the prevalence of the disease within the ethnic group, but you cannot look at the prevalence of the ethnic group in the population. And our numbers bore that out, that we had a lot fewer South Asians in the ethnic database than we know there are in Ontario from the census. The corollary to that implication also is that it doesn't, the people who are identified using the surnames algorithm do not comprehensively represent all South Asian and all Chinese individuals in Ontario. So the Chinese list, as I alluded to earlier, is mostly Han Chinese surnames, which is a large proportion of the Chinese population in Ontario, but it's not the whole thing. And there's increasingly, for example, a large Tibetan population in Ontario, which is of Chinese origin, but will not be captured through this surnames method because it's only really focused on Han surnames and various anglicizations of Han surnames. And then the South Asian surnames list, as I alluded to earlier as well, are mostly the Hindu and the Sikh names, which will be common in many parts of India, and Sri Lanka, but are not going to be capturing the Muslim names that are shared with other parts of the world. So, and those names are, of course, are the dominant names in places like Pakistan or Bangladesh. So we are really not going to be capturing the large Pakistani or Bangladeshi immigrant population using the surnames because those surnames are not uniquely South Asian. And so really when we are looking at that South Asian group, it is really a predominantly Hindu, Sikh, Indian, Sri Lankan population. And as I mentioned earlier, also the Goan population, which is not huge, but is certainly significant in Canada. In Ontario would also be missed. And then finally, there's of course the issue of changing surnames or offspring surnames, and this is going to be an issue that grows over time. With the definition of the way that the database is constructed, we do use the person's first surname. So their oldest surname in the RPDB is the one that we use to assign which group they belong to. So if the name changes later on, that is not reflected in their assignment in the surnames database. So that will, in theory, allay some of the changes that may occur due to marriage. And at the time that we did the study, the validation study back in 2010, the two ethnic groups with the lowest rate of marriage outside of their ethnic group were South Asians and Chinese in Canada. Whether that's still true 15 years later, I'm not sure, and whether that will continue to be true in the future, who knows. And it still doesn't get at the issue of offspring surnames. So the children of those marriages who, although we wouldn't have necessarily changed the surname of the person who changed their name after marriage, the children's names would not necessarily reflect that potentially different ethnicity than what their surname reflects, or mixed ethnicity. So these are some of the implications that we need to think about when using these data. So then more recently, in 2020 now, so it was about 4 years ago, we were starting to get into this greater understanding of race and ethnic data and related data at ICS, and what we have and how we are using it. And of course, by then the amount of data sources that we had had vastly increased, and many of those other data sets had different types of race and ethnic data included in them. And so one of the things that was done was we were asked to create a working group to really look at the ethnic database, as it was called at the time, and try and come up with some recommendations on what to do with it going forward. And so I chaired this group, and we had several ICS folks on it, who, familiar faces there. And our task was to really identify the benefits and limitations of using surnames to identify people with South Asian and Chinese origins within the ICS data, and then to determine what the best approach for the use of those data going forward would be. So we met a few times over the few months and came up with some recommendations about 4 years ago. And these are really to summarize the recommendations that the working group came up with. So that, first of all, teams that are using this data set must demonstrate that their objective is to investigate gaps in care or unequal access for the cohorts that are identified by the data set. So it really had to be around understanding inequities in healthcare. That had to be the purpose of doing the work. And the reason you were interested in ethnicity was to get into those sorts of important clinical or access issues. Secondly, the recommendation was really that the data set should only be used to form a cohort or to define a primary exposure variable, and that the use of the data to identify a covariate or an adjustment factor, which had been done in a lot of studies over the years, should really be terminated. And so that was one of the recommendations that we put forward. We wanted that the limitations of the data set that I was talking about on the previous slide were really going to be acknowledged in any research outputs that came out using these data. We suggested that the name would be changed because ethnic really probably doesn't capture what we're talking about, especially given that it only related to 2 groups to begin with. So we proposed changing the name to surnames, which is why the new name has been implemented. And then finally, we recommended that ICS consider changing the access to the data from general use to controlled use to ensure that all of these other recommendations would actually be complied with. And so now here we are, 2024, and many of those recommendations have been implemented, and there is this now a new controlled use policy and process for accessing the surnames data. So there are a number of things that are required for this controlled use access. So number one, the recommendation is that teams wishing to use this data are encouraged to engage with communities or with stakeholders early in the research process. Again, this is not a mandatory requirement as yet, but it is strongly encouraged. And, it's frankly good practice for any work doing any research should be really working with communities and working with the people who are being studied. And particularly when we're talking about these kinds of potentially sensitive data around race and ethnicity, the people who are being studied should actually be included in the research process right from the beginning. There is now a new data access form that needs to be approved prior to submitting the PIA. And that form goes through some of the criteria that we talked about in terms of ensuring that the data are being used appropriately for creating a cohort or defining primary exposure rather than a covariate. And that other aspects of the requirements that we set out as a working group are adhered to by the research team. And then finally, the process requires that research teams commit to using recommended language around the limitations of the data set whenever they're using it. So, I mean, of course, most important in manuscripts, but they're also in reports, but even in grant submissions, so that it's recognized what are sort of the constraints around the data and how they should be interpreted. We haven't sort of mandated specific language be used, as is the case for some of for acknowledgements that where the specific language is mandated, but we have sort of talked about what are the key points that need to be addressed in a manuscript to really ensure that readers of your work can understand the potential limitations of the method of using the surnames database. And so the language is here. So, that it identifies people with origins based on their surnames as a proxy variable, so that make it clear that this is a proxy, it's not self-reported ethnicity, that the lists have high specificity and low sensitivity, which we know, but what are the implications of that? That needs to be discussed. So it excludes certain surnames that are not unique to this population, and therefore only subsets of the South Asian and Chinese communities are actually being identified, and that the results of your research may not therefore be generalizable to the entire South Asian or Chinese population. And finally, that the comparison group or the third group or the non-Chinese, non-South Asian population includes both people with European origins and those from all other racial and ethnic groups that are not identified through surnames, and so that it really needs to be understood what you're actually comparing against in that population. And so that is really what the new controlled use process is all about. And at the end, we'll have a chance to sort of talk through that. And if you have questions around that, we can discuss that as a group. So finally, I just wanted to end off with some examples of where the surnames or ethnic data set has been used in ICS studies, and just give some examples of, highlight some of the things that these studies have done well. And we can use that as sort of learning for our own work going forward. And I've tried to pick studies that I wasn't involved in, just to, not to bias the sample at all. So this is an example. The first one that I want to show is a study that looked at end-of-life care in Ontario. And again, the strength here of this study is that they are really focusing on Chinese and South Asian ethnicity as as what they are studying. That's what is of importance in the study, is understanding differences in health outcomes or in healthcare utilization in these populations compared to other populations. And it's not just sort of a covariate or something that we're adjusting for. And so, we can see in the figure that they've really presented the relative risk for all of these adverse outcomes in both the Chinese and the South Asian population. And then their limitations section, they talk about many of those limitations that we had meant that are now going to be sort of not mandated, but strongly recommended to use. So they talk about the potential for misclassification, that there's, very specific subpopulations of the South Asian group that are included, and that poor sensitivity, means that other populations will not be included, and that generalizability may be a problem. And they also talk about, the importance of qualitative data, for example, to understand attitudes, treatment, and experience, which again, another sort of enriching our understanding of the experience of Chinese and South Asian people in the healthcare system beyond just what the administrative data shows. So again, that's another, I think, important point about being sort of thoughtful about how your data are being used and applied. Another example of a study that I was not involved with, but it also used these data, is this work looking at COVID-19 and cardiac and neurological complications, but also just generally speaking, COVID complications in South Asian and Chinese Ontarians. And so, the figure shows the sort of differences in death rates, the differences in ED visit rates, hospitalization rates, and so on. And I think what was really important about this paper and what it did well was to really look at some of the explanation for why these differences exist and be thoughtful about that. So, for example, it could be a part of contributing to a large proportion of the South Asian population being frontline healthcare workers or working in distribution centers or at-risk workplaces. So again, thinking about why these disparities exist beyond just ethnicity, but about the sort of social and socio-demographic context that South Asian people live in as an explanation for the observations found in the study. Differences in vaccination rates, differences in mask use, and other things that may be sort of implicated. And then talking about, residents in long-term care, and that maybe that's an explanation for why rates are different in different populations. So again, just being thoughtful about the implications and the explanations for your work beyond just simply ethnicity, because ethnicity is still ultimately just an association and a marker for many other healthcare and determinants of health that are important to consider. And then finally, the last one that I want to show, I was actually a co-author on this one, but this is looking at inflammatory bowel disease. And again, focused really on differences for South Asian and Chinese people and understanding the implications of IBD in these populations. And again, here looking at what they've done well here is looking at, the Western world incidence is stabilizing, but in newly industrializing countries, it's entering an acceleration in incidence. And therefore, that is reflected in what we're seeing potentially in migrants from those regions to Canada, where the rates are comparable to those in Western countries. So that, again, is thinking about comparing diaspora populations with what they are in the home countries and trying to understand the differences of the experience people living in Ontario versus those who are in the source countries. And how that might impact health disease prevalence as well as healthcare utilization. So that were the 3 examples. So I just wanted to wrap up then and open it up to questions for the last 10 minutes.
Great, thanks so much, Beju. And hopefully that helped too. I know we kind of made this change earlier. I think it's been a couple months now. But I imagine folks may still have questions or haven't kind of used the data since the changes were made. So open to any questions you had about that, the changes to controlled use, or just general questions as well.
And sorry, Laura, I don't know if you had other things to talk about as well before we get to the questions. I just jumped straight to the questions, but that was my...
No, that was perfect. I do see someone has their hand raised, so please go ahead.
Hi there. Thank you, Baiju, for the presentation. I just have a question about interpreting when this is like an exposure compared to the general population, this ethnic, because then I guess this goes for a lot of, let's say, chronic disease algorithms too that have, let's say, lower sensitivity. How do you conceptualize comparing it to the general population there, where maybe a high proportion of the people that you'd want in your exposed group are in that group, but I guess maybe it's a small fat portion of the general population. I guess how do you interpret that from your perspective?
Yeah, I mean, exactly as you say. I think the way I've used it is to say, we are looking at a population that we have tried to enrich as our cohort of interest is the South Asian population, which we have tried to enrich as much as possible to ensure that people in that cohort with a high degree of specificity are South Asian, but that the general population includes, a large chunk of South Asians as well as Europeans and, other ethnic groups in there too. So it's a hodgepodge. Like I wouldn't call it a European comparison group or I would just call it the rest of the Ontario population, with the acknowledgement that, a chunk of the South Asian population is in there as well, which is going to bias the study towards a null result, et cetera, et cetera.
Thank you.
Great. Elise, are there any questions in the Menti? I don't see any in the chat yet.
Yeah, nothing in the Menti right now. But folks, yeah, you're welcome to raise your hand. You're welcome to pop things in the chat, or if there's anything you prefer to ask anonymously. Oh, here's one right now. Where to find the limitation wording on the intranet? It would be nice to have it on the Internet Data Dictionary info page. Yes, we can drop the link to that right away here.
Mm-hmm.
It's on the
Yep,
data
yeah.
obligations page, I think, but I think I agree. Having it on the actual info page would be useful.
Yep, absolutely. And again, if you have any questions or want more clarification, you can also connect with us at public@ics.on.ca as well. Happy to walk you through anything. We'll give a few more minutes just to see if any folks have any lingering questions. I don't see anything in the chat further.
Okay, here's another one that just has come through the Menti here. Someone is asking, are there general ICS guidelines or typical practices to define what sensitivity and specificity thresholds exist to define cohorts or covariates?
It's a good question. I mean, I don't know that there is anything sort of standardized. I mean, I think, as with everything, it's a qualitative judgment, right? Is this sensitive enough or specific enough? And I think acknowledging that and being transparent about that is the most important thing, so that readers, knowledge users can really interpret or understand the parameters or limitations around what you've presented. But there's no magic number, I don't think, for a threshold for what's good or what isn't good.
Any last questions from folks on the call? Any last things that you are interested in? Oh, there's a question in the chat here. So it says, I thought about this a lot in terms of the good enough question in a recent paper I worked on. We decided that the thresholds really relate to the underlying population prevalence, so can't make a generalization.
Yeah, I think that's totally legitimate too, and fair. Like, you have to, it depends, it's context specific, right? So
Okay. Maybe we'll stay on for another 2 minutes, just if there's any last questions. But as mentioned, you can find all the obligations on the data dictionary under the data holding obligations. Feel free to connect with us if you have other questions after the fact. But otherwise, thank you all so much also for joining us today and hearing a little bit more about this. I will do one quick plug before everyone goes as well. Our sessions with Dr. Arjuman Siddiqui, we still have one appointment left, and these are the kind of one-on-one sessions where we dive a little bit deeper into any things related to social variables. So still one session left if you're interested in those as well. At least just put the how to book a chat in, or how to book an appointment in the chat. Any last questions in the Menti, Elise?
Nothing here right now.
All right, I see some folks signing off, so maybe we'll end it there. But thank you again so much, Bijou, for the presentation and giving us a little bit more information. So really appreciate it.
thank you. You're welcome.